Hi everyone, welcome to our channel. In today's interview, we are having Nazrin Shahnaz. She is CEO at Shahnaz Healthcare Interiors. Nazrin have 29 plus experience in healthcare segment. So welcome Nazrin to our show. I know you're looking very fresh. You are based in Malaysia, and there will be a early morning, fresh. So yeah, it's a good way to start our interview today.
Yeah, thank you for having me, Komaldeep. You look so pretty as well.
Thank you so much, Nazreen. So, Nazreen, I was just going through a lot of social post and profile, and I got stuck into the thing you are doing, and it looks very much interesting. So I thought let's get connected and let our viewership also know this unique concept of the thing which you are doing. And I will not explain everything. I want to create a suspense, and you yourself, will be telling in detail about what you are into, what you are planning to do. So, to start with, as a healthcare design specialist, uh, before this, okay, Nazreen, I just want to understand about your company. What are you into it? Then, we'll understand more detail about it.
Okay, so I'm Nazrin Shahnaz from Shahnaz Interiors Neighbourhood. So I'm the founder of this company. Previously, in 2010, we started off doing residential, government, corporate, and everything else. Then we were doing it for the sake of doing business, right? And then only in 2019, I got this invitation for a tender for a healthcare project. So I jumped in, and then when I start doing that project, it got very, it got me very excited because it was more than aesthetic. It was more than doing something for the purpose of making it look good. It was functional. There was a lot of doctors, patients, involvement in the design that got me engrossed. And after that, I said, I want to pursue in healthcare. So I went and further my studies in master in healthcare interiors. And then after that, we were all cruising towards healthcare.
Awesome,
So
awesome.
we did both hospitals and clinic, both government and private.
Yeah. So you just mentioned that, it's a healthcare interior. So what does it mean? You provide the infrastructure and you provide the manufacturing for healthcare. So what it is all about?
Okay. So what we do is that we are usually engaged under architect. So architect will prepare the infrastructure and the layout. So what we come in is we help them in terms of finishes, the paint colors, finishes, the ID, the built-ins, loose furniture, and also stainless steel. So we also do consultancy. That means from the planning perspective until the fabrication at site.
Awesome, awesome. Looks
Yeah.
interesting. So as a healthcare design specialist, right? How do you plan to use the recent budget allocation to not just repair, but also redesign the neighborhood clinic Kesihatan? Yeah.
Okay. To make readers or listeners understand, Klinik Kesihatan is a government initiative. It's a government facility. They have 1,500 nationwide, and it was built 15 to 50 years ago. 15 to 50 years ago. So it served as the primary assessment, especially for rural. But upon that process, having that asset, and however, it was poorly maintained, and government doesn't have the fund to actually maintain that facility because of the large number they have. And government are prioritizing on building new hospitals. So because of that, we have assets, but it's poorly maintained. So when we look at this Klinik Kesihatan and we visited few, we understood that it has a different issues individually. First of all, the space planning was to accommodate those days, the populations of 15 to 50 years ago. So it's now overcrowded. And then the layout is not suitable. Some of the design is outdated. So when we come in, we say it's not enough to just repair. Because if you repair, it's just fixing the problem, but not understanding the whole large problem of it. So we were suggesting number one is repair, yes. Number two is rebranding. Number three is maintain. Why I say rebranding is because I want to put back the importance of Klinik Kesihatan in the mind of consumers. Consumers need them, but looking at how outdated Klinik Kesihatan or how maybe perhaps unhygiene and all this, giving a bad impression that do I really want to go here or should I go to the private? But the facility is ready. We have doctors, excellent staff, but people are not going.
Yeah, true, true, true. So, because Nazrin, what I believe is, you just mentioned that private clinic and government. So, what I believe is, it's my personal, belief that government doctors are not against anyone, but government doctors are more you can say specialized, or because they have gone through a lot of complicated cases, so they are more experienced than comparatively. Nazin, you just emphasized the importance of interior design for boosting patient morale and healthcare professional work environment. So can you share a specific example from your past projects where design made a significant impact?
Okay. So when I say I'm an interior designer, people always think that it's about decorating.
Yes.
But there's when I keep reading, right, there's a lot of evidence-based research that says, especially when you do in hospital, you evoke a positive emotion in patient. Patient come in with various emotion. People come in hopeless, feeling sad, feeling they need help. But when you come in the hospital where everything is white, it smells chemical, it smells,
Yeah.
very unwelcoming, then you get sick more,
Yep.
right? So what we do is that we help people ease that emotion. We welcome them, we invite them, so that we can change the culture of going to the hospital is getting sick, sick
True.
care. But it is actually about wellness. Going to the hospital needs to make you feel good about yourself, understanding what your body needs, what is it lacking of, and what you need to feel better. So that's a concept. Although ID is just one bit of it, but it's actually solving a larger issues in the society.
Yeah, Nazri, no, you have correctly mentioned, because I feel that if, a patient have a very small pain in stomach or something else, so when he or she goes to the hospital mentally, uh, by the smell you just mentioned, right? Mentally, he or she got more sick, right? So,
Right.
so you just have pointed out the correct point. Yep.
There's this one hospital that I was involved in. It's an oncology department. So it's a cancer center, right? And it is built around 50 to maybe 100 years ago. And then it is situated above the hill. So it's very interesting. The landscape is amazing. The view is amazing. It's just that when you walk in, you see cancer patients, and then you see also the wall is all white and it looks very sterile and institutional. And then it was bought over by another group. So when that happened, we were involved in rebranding and redesigning work. So we had the chance to change the environment and then to create a therapeutic garden and then also to have a very motivational murals along the corridor. So when you walk in, you feel that, oh, you're reading something that makes you feel emotionally better and positive. So that's what we did.
Yeah, nice, nice. Good to know that. So while doing all these changes, you just mentioned the example of cancer hospital. So could you delve into the science behind the art of design? It goes into your mind, and how do you believe it can make the work of doctors, nurses, and caregivers easier and more sufficient?
Okay. When we talk about staffs and doctors, they are there for long hours, right? Sometimes 12, sometimes 23 hours. So when we design, we also take into consideration what are their needs. That means if it's what are the circulations? That means from counters to the wards or the beds. how far is it? Is there any way we can shorten the distance? That's what we do also. And then at the same time, we also provide spaces for them to relax, calm themselves, have a little bit break before going back to um, helping with patients. So that's one thing. Another thing is that when we design, we would have a active conversation with them. What is this? Is it okay? Is this not okay? According to how they work, their work pattern. So each hospital is very unique in that sense.
Yeah, true. And
Yeah.
in COVID situation, it becomes more harder for everyone, for doctor, nurses, caregivers. They have to work, and there are a lot of patients, who are coming. It was always overwhelming for them, non-stop.
Yeah.
They have to work. Yeah, that's
Yeah.
true.
So because of that, nowadays after COVID, hospitals are having staff lounge, doctors lounge, and
Okay.
that looks really amazing. Like those in the airport, they
Yeah.
do have this kind of setup. So I think that's amazing.
Yeah, so you just mentioned that, they have after COVID, they have a lot of space for their, relaxing and all. So how does this interior design factors into your strategies for improving the overall efficiency of Clinic Kesihatan and reducing the wasting time?
Okay. Issue with
And reducing
clinic
waiting
research.
time. Yeah, sorry.
Issue with Klinik Kesihatan is that, like I said, it was built those days without any future growth in mind. So, in order to maintain or even facilitate the issues here right now, we have to understand individually what's not working. If it's a layout, then something has to be done. Some Klinik Kesihatan is located in very small areas, so expansion is out of the way.
Yeah.
So if that happens, then we need to sacrifice some of the small areas, the non-clinical areas to accommodate. So issues with emergency department is sometimes the bed is not enough because the space is
Yeah.
not enough. So when we come in, we have to mitigate this issue and offer solutions.
True.
Yeah.
True, true, true. So what kind of public and private, funding initiatives do you believe could boost the efficiency of Clinic Kesihatan nationwide?
Okay. Like government are not focusing on clinic kesihatan because it is a large number, and number two is because it is almost endless. They don't know where to start. Sometimes it's the roofing, but you can't just fix the roofing because the other areas are also in issues.
Yeah.
So we are suggesting that, look, the asset is there, it belongs to you. Let's have private companies or entities to help with the refurbishment, rebranding, and maintain that facility while ensuring that everybody able to access to Klinik Kesihatan for assessment. So nowadays, government are saying the bed is not enough. So they are catering for the secondary treatment. So according to WHO, they need 2.1 over 1,000 population. So what we have right now in Malaysia is 1.98 according to the statistics. So let government focus on that and private focus on building clinic kesihatan for the efficiency to 100%. We have done this before as a concession for highways, for medical equipment, for medical supplies. So why not start with clinic kesihatan? That's what I'm asking. Because if it's continue to run down, eventually we don't have any other options but to build over again, and that will be more expensive.
True, true. So you just had mentioned that, the Clinic Kesehatan, you have to rebuild, redesign. So in your view, what does it mean to redesigning existing Clinic Kesehatan branches?
Okay, redesigning for me is more than repairing. It's about checking in the layout, checking in what works, checking in what's not working, and then what is the issue of maintenance. That means if we repair right now, can this last for the next 10 years? Does it make sense in terms of the budget and the duration that it will last? Secondly is about inclusive design.
Yeah.
You see, people come into clinic in various conditions, body sizes, various disabilities, physical, mental, even visual. So some people can't see. Some people need wheelchair to access. Do we have this kind of facility at Klinik Kesihatan? If they can't see the signage, is there any way for them to access without getting help? Is there barrel indication? Is there tactile indicators? All these need to be considered if we want to continue um, to, make it relevant to today's world.
True, true. So, you just mentioned that Clinic Kesihatan have a lot of branches. So they might be in urban and rural areas, right? So how do you plan to meet the current demand for healthcare service in both urban and rural areas through design?
Okay. Rural and urban. Okay. What happened is that Klinik Kesihatan has few range from number 1 to number 7. So the differences is in terms of size. So in some urban areas, the size is bigger, and in some rural area, the size is smaller according to the population. So that's one thing. Number two is that how patient receive treatment differs. Okay, in rural, they come with few more companies. So in order to tackle that, you have to have a bigger waiting area.
Yeah.
And then they also come in with perhaps a motorcycle or car. So do
Yeah.
you have enough parking spaces? And then how long is waiting time from rural and urban? Urban, they need everything very fast. So in order for them not to wait there, can we have technologies in order to maybe have mobile a notification saying that okay, your numbers is up and you can come another half an hour. But in rural, then that may not work. Technology may not be so efficient, but maybe you can cater in otherwise. So I think in order to tackle this issue is going back to how do patients receive treatments in clinical setting, and how to make them accommodating to their staff.
True. So,
Yeah.
there might be a lot of planning and a lot of discussions might be having with government, and a lot of planning and a lot of inside data you might be working without. So, how important is unkeeping and maintaining these clients post refurbishment? What strategies do you have in place for this?
Okay. So I was during my conversation, I said, let's do building audit. Let's check what is the current status of the building. Can this last for next 10 years? If it doesn't, then it doesn't make sense to refurbish. If it does, then let's do audit pre of refurbishment, and then do a post refurbishment strategy on maintaining it. So how to maintain is that one thing, we must have a facility manager, either in the clinic itself, or we have another company that is responsible to handle few hundreds klinik kesihatan. And then there should be a schedule on what to maintain daily, monthly, yearly. Only then we can track whether or not this needs budget for next year, or this one can wait. Let's focus on the other one. So I think there's a lot of people that need to be involved in this. There's a lot of planning that needs to be involved in this. Do not do things just to repair and okay, let's go on. We don't know it, when the roof gonna drop into
True.
on the patient's head. That's scary to me.
True, true. So, Nazrin, after talking to you, I feel like for you it is a lot of physical and mental work might be going on, and majorly in your case it will be like emotional, because when you visit the facility will not be in that position, so you have to go through it and you have to make planning. Hats off to you, the thing you are doing. It takes a lot of courage. Yeah, 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 it takes a lot of courage. And lastly, can you share your vision for the role of design in creating better environment through good design as per your company's belief?
So for me, great design is something that is more than aesthetic. It is about functionality. It is about inclusive. Nowadays, why I'm doing this is because I also had experience whereby I'm seeing my parents get sick and how they are treated in the hospitals and what they feel emotionally. So for me, if I can see that my parents deteriorate um, or feel emotionally down when they are there, then I don't want other patients to feel the same. Okay. So I want also people to feel included in the design, whereby if you are overweight, I have beds that is suitable for you. I have toilet seats that is suitable for you. If you are not able to see, then I have burrell for you, signage. I have tactile indicators for you. If you are in wheelchair, I need to make sure that the circulations or the corridor is wide enough for you to roll down on yourself independently. So I want to build something that is functional as that. And at the same time looks good, at the same time make people feel good being there.
True, true,
Yeah.
true, 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 true. So, thank you so much, Nazri, because I was not aware about this concept as of now, the medical interior facility. So, after talking to you, it sounds like, you guys are doing very good. And I think if there is on the track, everybody, will be going in the hospital with a good interior, with a good vibes, because there will be a good energy around them. So it will make them feel more confident into them. So, thank you so much for your time for today and have a good day.
Thank you so much for having me today. Thank you for this opportunity.